Most people believe that surviving a stroke is a blessing, that as long as you're alive, everything else can somehow be fixed. But here's a question few people ever ask. What if surviving a stroke is not the victory we imagine? After decades of treating stroke patients, many experienced neurologists in the United States have come to a difficult conclusion. For some people, there are outcomes more frightening than death. And today, I want to explore why, based on real clinical experience and patient stories. Many doctors believe that stroke can be worse than death. If this is your first time watching Shiny Vital, welcome. This channel is dedicated to clear, science-based conversations about brain health, stroke prevention, and long-term well-being. If that matters to you, please take a moment to subscribe. Now, let's begin. Many doctors agree that modern medicine has become very good at keeping people alive. Dr. Matthew Walker, a British neuroscientist and professor at the University of California, Berkeley, has spoken openly about this idea. He explains that while medicine can preserve life, it doesn't always preserve the person. Nowhere is this more visible than in stroke care. In emergency rooms across the United States, the goal is simple and urgent: restore blood flow, protect the brain, save the patient's life, and very often, doctors succeed. But what happens after survival is rarely discussed outside hospital walls. Because survival does not always mean recovery, and recovery does not always mean returning to the life you once knew. Neurologists at institutions like the Mayo Clinic and Johns Hopkins Hospital describe stroke not just as a physical injury, but as an injury to identity. Dr. Jill Bolte-Taylor, an American neuroanatomist who worked at Harvard Medical School, experienced a massive stroke herself at the age of 37. During her recovery, she described something most patients struggle to put into words. She said that she could think clearly, but she couldn't speak. She could feel emotions, but she couldn't control them. It felt, in her words, like watching her life fall apart from the inside. Depending on which part of the brain is affected, a stroke can take away the ability to speak, while thoughts remain intact. It can erase memories, or change personality and emotional control. This is why neurologists often say that stroke doesn't just damage the brain. It can dismantle the self. Dr. David Greer, an American neurologist and former president of the Neurocritical Care Society, once shared a case from his years in major U.S. hospitals. The patient was a 52-year-old man, healthy, active, successful. He survived a large ischemic stroke. Physically, rehabilitation helped him walk again. He could eat on his own. He could dress himself. But cognitively, everything had changed. He struggled to follow conversations. He couldn't plan or make decisions. His emotions became unpredictable. Months later, his wife said something the medical team would never forget. She said she didn't lose her husband that day. She lost the man she knew. His body survived. But the person he used to be never fully came back. Many senior neurologists, especially those who have spent decades in stroke care, admit that stroke is one of the most feared outcomes in medicine. Not because it always causes pain, but because it can leave people alive without independence, without dignity, without control over their own mind. A study published in the journal Stroke by the American Heart Association found that a significant number of stroke survivors rated their quality of life as worse than death. Not because of suffering alone, but because of total dependence on others. Stroke never affects just one person. It transforms spouses into caregivers, children into decision-makers, homes into long-term care spaces. Researchers like Dr. Laura Gitlin, an American behavioral scientist who studied caregiver burden for decades, found high levels of depression, exhaustion, and financial stress among families of stroke survivors. Doctors may save a life in the hospital, but families live with the consequences for years. And this is why prevention matters more than treatment. Here is the hopeful part. According to the Centers for Disease Control and Prevention and the American Stroke Association, up to 80% of strokes are preventable, not through extreme measures, but through consistent protection of the brain, healthy sleep, Early blood pressure control, reducing chronic stress and inflammation. As many neurologists say, you don't wake up one day and suddenly have a stroke. Your brain has been asking for help for years. Listening earlier changes everything. Stroke is terrifying, not because it can end life, but because it can leave life unfinished. The goal isn't just to live longer, it's to live whole. If you found this video valuable, please subscribe to Shiny Vital. Share it with someone you care about, leave a comment below, and join us for more clear, science-based conversations about protecting your health and your future. In the next video, we'll talk about BEFAST, the warning signs that can save a brain in minutes.